Hello dear friends, good evening. This is Dr Suresh Shenvi and welcome to Aspire32. Today we are going to learn another new topic, and it is actually a continuation of the earlier video which I uploaded few days back, and that was about direct filling gold. And few of the viewers did ask me to cover the manipulation of direct filling gold, which is very important because most of the foreign entrance exams and even Indian entrance exam do ask you about this question. And there are some very specific MCQs which often repeat in all these exams, which we'll be discussing in today's video. Let us first understand what is the objective of condensing, or some people call it as compacting, of direct filling gold. And there are many reasons. Since the direct filling gold is available as a foil, which is not a fluidic material like amalgam, when you mix it with mercury, you tend to get it in a very moldable form. But here, since you are actually trying to condense the gold, that is the direct filling gold, either in foil or matte gold format or any format, that you have to condense in the cavity preparation. So the idea is to wedge these initial paces between the dentinal walls as shown in these images. And then, as I told you in the last video, that if somebody asks you why direct filling gold is used as a restorative material, then the most important answer which you have to remember is that it has an ability to cold weld. So that means without the use of a temperature, you can weld two or multiple increments of gold one another. So the idea of doing the compaction is the same. And as I told you, and this is a very important MCQ question which you have to remember, that no matter which type of direct filling gold you use, the voids will be always present. But if you do a good condensation, then the voids can be reduced. I have discussed in the last video that which type of direct filling gold will have higher chances of the voids in it and which will have a lesser one, and those often appear in the exam. The link for the earlier video of direct filling gold is there in the description. And of course, apart from this, when you cold weld the direct filling gold, there is something called as a strain hardening. You are applying pressure at a room temperature, and repeatedly when you apply this pressure, this leads to strain hardening, and this is seen to increase the strength of the direct filling gold in the restoration. And I also came to know about this important property that when you condense the gold, the dentin is elastically deforming. That means the cavity is slightly enlarging wherever there is the gold which is present, wherever you have the dentin which is present. And once the compaction is over, the dentin is slowly coming back to its position. So any space which is remaining between the first increment of the gold and then the dentin, that will close if you have done a compaction properly. And this property, that elastic deformation of dentin, can be beneficial to the restoration. So once you understood the objective of compacting the direct filling gold, what are the modes in which you can do it? And basically, they are divided into 4 categories. The hand condenser, that is we all condense the amalgam. We just use those hand condensers, right? You can use those, or you can also use hand condenser with a mallet. And then you have pneumatic condensers and you have electronic condenser too. And we'll discuss each one by one. The first one, that is the hand condenser. This is how they appear. Unfortunately, I know that as a student, this topic is very difficult to grasp because almost most of the dental colleges in the world are not doing it. So I did not find good pictures of this instrument, but whatever I have found, I will try to explain it in a simple way. So these are the hand condensers which you hold in a finger, and then try to apply pressure. The important thing to know that there are always serrations on these type of condensers, which are very similar for the dental amalgam condensers also. But what is a major difference? As you can see in this arrow, which is red in color, it is basically telling you that these condensers are pyramidal in shape at the end. And this is very important because this will make indentations in the initial increment of gold which you have condensed, and over that the next will go and get properly condensed. So these indentations are really helpful for cold welding the subsequent layer of the gold. Now, as we discussed the hand condensers, there are some different types of hand condensers which are rarely asked in exam, but you should know. The first one being the round condenser as shown in the picture. And this is mostly used at the start of the compaction, and there is a step in the direct filling gold which is called as tie formation, which I will discuss in the upcoming video. And there is parallelogram condenser also, which is very similar to what we have in dental amalgam condenser. Here this too is used for initial increments, but it can also be used to build the bulk of the direct filling gold. And then you have the foot condenser, and you can see the shape of the tip in this image. It appears to be round, but the whole condenser is not cylindrical. It is only the tip which is there. So this is called as a foot condenser, and this is important in certain steps which I will tell you in the upcoming slides, and this is also used for the bulk. But the problem of using just hand condenser is that they are very inefficient, because you will not be able to apply good amount of force, and that is very important for cold welding the two layers of direct filling gold. And they are difficult to control also, because it depends on angulation. You have to concentrate so much, and that's why they came with hand condenser with mallet, where basically you have this mallet, you keep the gold at the pallet, the gold foil or any small piece of it after degassing, and then you place this condenser and apply the force with the mallet. So that's basically like hitting a nail. And although this is better than the initial mode of condensing, this is generally preferred for initial steps. It cannot be used for the bulk of the restoration because it is also inefficient. And then came with the pneumatic condensers. This is how the tips and the instrument appear. Now I know it may be difficult to correlate what exactly is pneumatic, but I do hope that you may have seen a person working on the road and he has that machine which is making a lot of noise, and you will see a generator or a tractor which is generally attached to this unit, which basically pumps the air, and because of that air there is a movement in the tip. That's why it is called as pneumatic. But the amount of force which you can apply on the tooth is dependent by the flow of the air in this unit. But the problem is it applies too much of force, and it is not good for the teeth, because you may plan to do a restoration. You don't want to create fractures in the tooth. That's why this doesn't have a good control. And out of all the methods which I have mentioned till now, the best one is the upcoming one, that is the electronic one, because it is the machine which is precisely deciding the speed, the force, the amplitude which is set for the compaction of the direct filling gold. That's why this is found to be very efficient, and out of all the methods, this is the one should prefer for compacting the direct filling gold, because it is efficient and easy to control. You won't unnecessarily put a lot of force on the tooth structure. So if you are using any method which I have mentioned till now, but there are certain principles which you have to follow. In the initial increment, the force should be 45 degrees to the cavity wall and the floor. For example, this is the initial increment. Now you can see the force which is put is in a vertical direction, that is parallel to the long axis. But what will happen? This force will try to push the gold foil on the side of the cavity preparation, right, in the center. So that's why it says that the initial increment, the force should be put 45 degrees, and this is a very important MCQ. The force should be put 45 degrees, okay, so that this adapts very well to the line angle. And then subsequent layers you can follow the 90 degree, because there you have already built the line angles and point angles with the direct filling gold. And once you do that, the textbooks also say that you start at one side. Okay, if you imagine you are starting on the mesial side towards the buccal, and then from there you should go towards the distal side, that is the buccal of the distal side, and then come back to the lingual of the distal side, and then you come ahead to the mesial of the lingual side. And every time when you come on the other side, or even when you are putting the next increment, you should know that the new increment should at least overlap the earlier condensed increment by 1/4, as clearly mentioned in this textbook. You should also use minimal thickness, because the aim is to reduce the void. If you use a lot of thickness, then it won't. And the force should be as required. It should not be less, it should not be too much, thinking that okay, I may do a good compaction, but then the issue is that you will be unnecessarily putting a lot of stress on the tooth and it may crack. Now when you are reading the MCQ books, this is a very important question which you have to understand. If you have a smaller head, then the effective force what you are putting, it will be more. For example, you have two instruments, one with a smaller head, one with a larger head, and you are putting equal pressure, but the pressure or the force gets magnified in this smaller instrument automatically, and this is based on the physics, and most of the textbooks have explained this. You have to remember it. There is an equation which is given in the textbook, and I hope that you will check it out. So since you understood it, let us see the steps in compacting the direct filling gold in the cavity preparation. And there are 10 steps. There are 10 steps of condensing the gold, direct filling gold in the cavity preparation, which is highlighted here, and I will be discussing it in the upcoming slides. The first step is the tie formation. Now as you can see in the picture, the tie formation basically means that you start at the point angle on one end and go towards the point angle on the other side. Start with mesial and go towards the distal. So you are basically filling the line angle from one end to another end on one side of the cavity preparation. That is called as the tie formation, and this is important because it forms the foundation over which you will subsequently compact the other the increments of the gold. Then you have the banking on the walls. So this is also the step in which basically you go on putting the increment, and that will increase the bulk. But here you are connecting the floor on one side to the cavus surface on the same side on the top. So you are building from the floor to the top on one side of the cavity preparation. That is called as banking on the walls. And then you do the same step on the other side and you join these two things. That forms the shoulder formation. Now the tie formation, banking on the wall and shoulder formation are the main three steps which form the bulk of the restoration. So major work is done here. And then you have something called as paving. Now as I told you that there are golds which have a good amount of that is matte gold which have voids. So sometimes you have to use a foil over this gold so that in the top portion you don't have voids. So that is exactly done in this step that is called as paving. You are taking a gold foil and you are veneering it over the already condensed gold. So you are making sure that the top portion has the good amount of direct filling gold, which is strongest. And here we use foot condensers. After this, you apply good amount of force throughout this surface of the restoration so that any remaining voids or any spaces are closed very well. And this step is the surface condensing. Then you burnish. You have to burnish it, and while you are burnishing now, make sure that the burnisher moves from the tooth, the restoration, and towards the tooth surface so that it adapts at the KO surface margin very nicely. And then there is a step called as margination, where we use a carver, and you know that once you burnish, some amount of gold will be over the margins. So what you are doing here is that you are removing that excess till your KO surface margin is exposed. You are not overdoing it, but you are just making sure that the excess of gold is removed with the carver and the KO surface margin is reached. And then again you have to do the burnishing, because it is basically improving the surface structure of the restoration and trying to remove. And then you can use various the instruments, the burrs, finishing kits which are available for direct filling gold to contour it properly. Wherever you have to make a fossa, or if you have to make any grooves, you don't make fissures and pits in a restoration. Please remember, you make grooves and fossas. They are ideal. So once you do that, okay, that step is called as contouring. And then again burnish it. Burnish is very important because that gets the restoration as close as possible to the tooth margin. And as we have discussed in cast restoration, that this is the weakest area where you may have a micro leakage, which you don't want to do. So you can also do the burnishing again. And then you use the tin oxide or the plastic bristles or special bristles which are available for again finishing and polishing of this restoration. Again do the final burnishing. So burnishing steps is repeated many times and you may have difficulty to remember it. But please try to remember it if you are writing the theory paper. And that's all which is very important in the manipulation of direct filling gold. If you have any questions, please mention in the comment section and I will be happy to answer it. And do check the playlist on my channel, which can help you to understand the topic better. Thank you so much for watching this video. I will see you once again very soon on Aspire 32 with one more video. Bye for now.